you all for coming out. This collaboration is between the Student Psychology Association, PSI CHI, as well as the Peer Counsellor Association. If you have any questions, please feel free to stop us. And it is an interactive session because we would like to, destigmatize any myths or preconceptions about what is psychiatric medication, as well as the side effects or why it's actually good for you. So, without further delay,
So today we'll talk about how you can access mental health treatments through public healthcare. Well, at the Tacrigo Health Center, they have a psychiatric clinic on Thursdays. You can call in advance and they will tell you to come in on a Thursday at around 8 a.m. Or you can just walk in and speak to the receptionist and they will give you a number and you can go talk to the psychiatrist. So after speaking to the psychiatrist, they may write you a prescription if they give you a diagnosis, and then the pharmacy at the health center itself will give you the medication free of charge, of course, because honestly, psychiatric medication is very expensive.
and now on to financing our psychotropic medications in Trinidad and Tobago. So, some of you may be aware that 4% of healthcare expenditures by the Ministry of Health are devoted to mental health. So, if you want to be specific, it's 4% of the national budget. So, out of that allocation of money, they use 85% of it for the mental hospitals. And all of Trinidad's population has free access to essential psychotropic medications. When we say essential, these are ones that you absolutely need. So, for instance, if you have a relative or you yourself have ADHD and you have high functioning ADHD, whereby it is, hindering your abilities to do daily functions, daily abilities, it is essential and you can actually go and get this medication for free from the clinics. And just a note, there are no social insurance schemes, but all mental disorders are covered by social welfare. The biggest share of mental health expenditures lay in the payment of salaries and wages of human resources within the sector. So this is why, it will be covered by the social welfare system. All clients or patients have free access to all essential psychotropic medicines. At least one psychotropic medicine from each category is available for all patients. Now, if you ask what they mean by each category, there are different types of medications for different types of disorders. So you have mood stabilizers, you have antidepressants, you have some for some certain types of episodes. So again, ADHD, if you have for autism, so it spans across the board. And mental health patients fall within the category of chronic diseases program funded by the government under that is the Chronic Disease Assistance Program. Mental health services are covered by the social welfare scheme again, and the government covers expenses for treatment and care in the mental hospital, outpatient clinics, and inpatient psychiatric clinics. Towards the end of this PowerPoint, we actually have resources and the link, which will take you to the Ministry of Health site where they have the mental health services, and they have from all areas in the island and in Tobago as well. So you can feel free to check that out after we have finished the presentation.
Personally, I actually have persistent depressive disorder. So I've been on antidepressants for the past year or so. I figured this would be a good thing to discuss how it works. So selective serotonin reuptake inhibitors, which are the most common types of antidepressants, work based on the assertion that depression is caused by the low turnover in the serotonin pathways. So serotonin is released into the synapse during stressful events and is then returned to the neuron. Antidepressants make serotonin more readily available by preventing the reuptake of the neurotransmitter by the sending neuron and allowing the serotonin to remain at the synapse. There's a little diagram there. So in general, it takes about 2 to 6 weeks for antidepressants in particular to take effect. And during this time, you will experience several side effects as your body adjusts to new neurotransmitter levels. because think about it. If you have depression for such a long time with that little deficiency in serotonin, your body isn't used to it. So your body would have to adjust to these new levels of serotonin. The downside, though, of serotonin reuptake inhibitors is that it also blocks dopamine pathways, which basically no longer allows you to feel pleasure or excitement. So things like love and pleasure, yeah, you don't really feel them. I'm personally emotionally numb, emotionally blunted is the correct term for that. So yeah, but honestly, I would say I don't mind taking them at all. So one thing that really hinders your ability to take medication and get better is your sleep. Sleep is very important in treating mental illnesses. So antidepressants you would think would normalize sleep, right? But they don't. Some of them actually disrupt your sleep. They lead to insomnia, or sometimes you would wake up several times during the night while you're trying to sleep and be unable to go back to sleep. There are some, however, that do improve sleep, but they have very strong sedative properties, which could hinder your treatment as well due to oversedation, meaning you would probably be asleep for far too long to actually know how it's affecting you. So it's very prominent. Insomnia is very prominent in people who use SNRIs and SSRIs. So unfortunately, depression cannot be successfully remitted while the issue of disturbed sleep remains, and I would assume that would be the case for other mental illnesses as well.
Or dealing with the side effects. So, as with any other medication you need to take if you want to feel better, whether it's mental, whether it's physical, you will always have side effects with medication. And we've listed a few side effects you would have, but also ways that maybe it could get better. So, first one is with sedation. So, this tends to be more common on starting a new medication or when the doses increase quickly. Starting a low dosage and increasing the dosage slowly can reduce the impact. Giving most of the dose at night may help, or a dose change may be required. If sedation is still troublesome, change to a less sedating medication could be considered. And another side effect is weight gain. This can be a problem with some medications, and I know all of us have experiences with any medication, especially for those of us who would have had to take birth control on the ill advice of a doctor. So just like with any other medication, psychotropic medications give you weight gain. You can maintain a healthy diet and get plenty of exercise in order to limit how much weight you will gain. Your doctor can provide appropriate support for weight management. Third side effect, dry mouth. Try taking sips of water with a bit of lemon juice in it, lemon and glycerin swabs. You can suck on ice, and there are sugarless gums you can take to try to reduce the dry mouth. If none of these strategies work, ask your pharmacist nearby about artificial saliva. I don't think they have it in Trinidad. That was just a fascinating point have here. But sucking on ice actually does help, and especially sugarless gum. Fourth side effect is constipation. So this can be a persistent problem. A diet high in fiber and drinking plenty of water and getting moderate exercise is recommended. Short-term use of bulk laxatives or stool softeners may be helpful. And another side effect is lightheadedness. Dizziness or giddiness on standing can be a particular problem. If you get dizzy on standing, sit down, wait a little bit of time, then slowly get up again. Nausea. This can occur in the first weeks of treatment. Taking the medication with food can help, and an anti-nausea medication may be needed. And the last one is uncontrolled urination. So you need to try to avoid drinking fluids in the evening. Make sure you have adequate inadequate bedtime. If the condition is so troublesome, your doctor can review and prescribe particular medications to help with this problem. Now, this is the point where I would mention that, again, with any medication, physical or for mental, you always have side effects. Don't let these side effects deter you, because the benefits do outweigh these cons. And if you all are still unsure, you can always ask your psychiatrist, because whenever you need to get medications, you always have to talk to that psychiatrist first. So they will always walk you through the side effects, they would explain what to do, what not to do, as well as they will advise you best on how best to manage the side effects. Right, and now is a question a lot of people are maybe afraid to ask if they are thinking about taking psychiatric medications. How long does this last? How long do I need to take it? So the length of drug therapy will vary with the individual and the severity of the disorder. You are likely to need medication for at least several months. Some people may need medication for a year or longer, even for life in some cases, to keep them well. So we know people who have major depressive episodes, sometimes like they will need medication if recommended by their psychiatrist, and they don't take it for long periods of time. It may last a few months. But others, if you have been suffering with clinical depression since you are about, let's say, 13, and you are in your late 20s right now, you still taking medication, and that is completely normal. That is fine, because just like with a physical chronic ailment, you need the medication to get better. Don't look at the duration as something as saying, oh my gosh, I'm becoming dependent on it, I'm becoming addicted to it. That is not the case. That is one of the stigmas we are trying to break today. You need it because it will help you. So if you have a chronic ailment, physical ailment where you always experience extreme pain, you take the medication so that you won't feel the severity of it that much. It's the same thing with the psychiatric medications. So this is something to keep in mind. Okay, you're not becoming addicted, it's just to help you feel better in the long run. Okay, so medication therapy generally involves a regular dosage scheduled, but in cases of mild or infrequent anxiety or agitation, you may be prescribed PNR medication. This means that the administration of the medication is not scheduled, but instead the prescription is taken as needed. Stopping medication requires as much care as starting it. Medication should be phased out gradually under direct supervision of your doctor. So any instance where you are given a dosage, and let's say that you want to stop the medication, maybe because you don't like the side effects, so you like to try a lower dosage or try a different brand for the medication, you cannot stop it abruptly or immediately. You need to contact your psychiatrist first to figure out what is the best way to wean it out first, and then to go on to a different one. And I'm sure some of us who have taken medications will actually be able to attest to this. So this is something to bear in mind. And now we have some tips on how to take your medication regularly. So as Ananda said, you will get withdrawals if you don't take your medication on time. So to avoid that, here are some strategies what you can do to remember it more often. Take it at a set time every day. What you could do, maybe you could set an alarm so that you could remember to take it. So if you know you take it in the morning around 8 o'clock, have your alarm at 8 so that you'll be able to remember to take your pills. And second strategy, link it to regular activities such as maybe brushing your teeth or eating lunch. What you do, you're conditioning yourself to remember, right, I can't do this activity without taking this medication. The third one is to keep a simple medication diary, like the one inside the front cover of a booklet, or you can mark it on your calendar when you take it. So if you just tick off every day, you'll see when you took the medication and if you skipped out a day. You can use a blister pack, satchel, or dosage box from your pharmacy. In those cute little containers, you'll see where you organize your pills according to different days. Those you can actually get, and just to keep your medication. It's a great way to keep track of medication you need to take daily. And the last one, the pods or long-acting injectable preparations can also provide a convenient alternative to taking multiple daily oral dosages of certain medications. I am not sure if they offer it in our medical hospitals, but if they do, this could be a great alternative. And that will conclude how to take strategies to help remember to take your medication regularly.
So now I will be speaking a little bit. So they already covered the points about dependence, where medication is not made to make you dependent. It is made to help you overcome your disorders and your illnesses. So, first things first, let me just let you all know, if you have to use the medication, please do go and use it. It is there to help you. It is there to help treat your disorder and help you recover in a timely fashion. And I will be addressing the societal or the physiological or whatever you want to term it as, stigma. So usually what tends to happen is that people tend to think about what others think with respect to taking psychiatric medication or any sort of like psychoactive medication. So they usually ask opinions. Should I take it? Should I not take it? And society has created such a toxic stigma about this medication that someone who actually needs it will tend to go away, will tend to avoid it. So something like telling somebody that it is a weakness to take medication, that is wrong, because it's just like a medical illness. If you were, let's just say you have a virus or some sort of infection, you will take medication to treat it. So people tend to view this medication as a weakness, and they make the person feel as if they are less of a person and they just not trying hard enough to overcome it. So people would tell you, boy, go on exercise, go on eat a healthier diet, change up your daily habits, etc., etc. And yes, while it might have benefit to your mental health, it does not help treat the condition. So while while it is beneficial to you as a person, physically, emotionally, mentally, it does not correct the disorder itself. So someone might say, okay, if I do this a little longer, if I exercise plenty, a little more, get on and go to the gym, it would help you in some ways, but it would not help you cure the disorder. So this is why I'm saying that it is important that you take a medication. If you see you have experiencing symptoms of different disorders, you go to your relevant areas that they would have covered previously, and you go and you get your diagnosis and you take a medication. And simple things. So exercise is one thing, diet is one thing, but the next whole other big factor is religion. Religion is one of those things. It's either people tend to make it very radical, or they make it very, let's just say, idiosyncratic. So religion by itself would tell you something else. So I am going on my opinion on this. This is not to disrespect anybody's religion or spirituality. This is from what I've been able to gather. So religion might tell you, okay, if you have some sort of trial or tribulation, turn to the Lord, turn to the God, and let leave it in His hands. Okay, and that's well good enough. It would give you some sort of mental hope or some sort of inkling to try harder, but it doesn't treat it. So spirituality and religion, it provides abstract sorts of markers for for your treatments and whatnot. So while you may believe in it fully and you may trust it fully, you don't have any proof of progress that you would have been making. So as they would have mentioned, when you're taking your medication, you would have like a list, set an alarm, use a calendar, you can take it off accordingly. That would give you tangible evidence to show that you are taking it for so and so period of time, and you are making progress based on your guidance of your medical professional. But when you're looking at things like religion and exercise and all these physiological, socioeconomic factors, you will not be able to track it. That is the main point. And not being able to track it does not give you a good gauge of how long, where you at in terms of healing, where you at in terms of trying to understand how you can go about making it better, how you can pace it, and all these various factors would tend to create an amalgamation of a big whole mess in your head when you're trying to figure out these simple things as opposed to being able to track it with your medication. So that is just one of the major points that I see happening a lot, and I think people need to stop doing that. Well, should avoid doing it. Well, yeah, just to give a bit of, impetus for people to take the medication. So next point I wanted to raise is that, well, it isn't really a stigma. It is more like an added benefit to a bonus. So when you do get over this, when you start taking your medication and whatnot, you should probably try to ask to see a professional, a psychiatrist, maybe, one of the asking about therapy. So they would have mentioned drug therapy. Now, ideally, this is the opinion I have been seeing a lot. Um, you should try to look into therapy by itself, one side. So while the medication would correct the medical and physical stuff, therapy would help you to rectify your behavioral tendencies that would result in a sense. So if you do the medication and the therapy simultaneously, you would be able to correct the two at the same time at a very regulated and guided pace. So it wouldn't be where you take a medication and you say, right, I feeling good. But the behavior that is left behind would remain conditioned, it would remain there. So, and then you would say something simple could trigger it. And let's just say you offer medication and you enter a situation where, oh my God, back to square one. And you will take a medication and whatnot, and it might help you. But if you add therapy to it and a little bit of, you know, behavioral adjusting, you would be able to deal with it on both ends. So it gives you a better and a stronger guard against falling back into your cycles or falling into relapse, as people would say. So so that's just basically what I wanted to speak of. And again, I would just reiterate, if you have to take a medication, do go and take a medication. It is free of charge. Well, most of them are free of charge. If you could correct me on that. Um, so do go and take a medication. It is meant to help you, not to harm you. So that would just conclude what I would have liked to have discussed. And thank you for listening.
At this point, I'd like to ask any of the executives from the other clubs if they would like to share a little bit about experiences with psychiatric medications, if they'd like to inform our participants of the experiences, what it was like to go for it, as well as a bit of like if you need to take any screeners, what kind of questions the psychiatrist might ask you, just so that they might be a little bit more mentally prepared when they actually decide to go and find out about it themselves.
Hi everyone, I'm the VP of SPA, Ali. I just wanted to add that I don't know if anyone's familiar with the process, mainly in South Health Clinics. But as Ananda said, you go in and you basically make an appointment, or you basically give you a day that um the psych services in clinic would uh basically have consultations or give out medication, etc. And that was generally a Tuesday or Tuesday. Um, I recommend, well, in my case, it was best to go in with a screener. And there are a lot of free screeners online, from depression to anxiety to ADHD. It would just generally be helpful to go in with one of the screeners to look it over, ask the questions you need to ask, and whether you are diagnosed or not, again, it's up to them. But also it's like you're in control. And if you really think from educating yourself online that I I'm experiencing a lot of symptoms from this specific, disorder or illness, and I really need to get treated. If you do not get the answers you needed from this specific psychiatrist, it's always, healthy to have further consultation with another, be it requesting meeting a different psych, or the possibility of going to a different clinic, and then you have the option of a private psychiatrist. So it is a process, especially in Trinidad, and I'm going to sugarcoat it. Um, but you know what you're going through, and that's a fact. And again, I'm all for, you know, being medicated. Medication from has helped a lot of people in my life, and I have seen more positives than negatives. But again, with everything in life, it always has a downside to it. So, you know, it is a matter of warming up the medication. Things will be scary because you don't understand it to begin in the beginning. But it's a process. So if you think that you are dealing with these things, self-diagnosis is a step I do encourage, but getting, you know, that professional diagnosis, you know, professional screening is the ultimate step.
Well, I would contribute. I am Crystal, the PRO for SPA, and I would like to add to the presentation as well, reference with the medication. Now, although yes, we have the different channels seeking to get help, there are some channels that in the same clinics they don't go straight to psychiatry first. They sometimes try before they do the medicating part, they might try the social worker. If the social worker can't um appraise the situation properly, then they might step up a little bit with the psychology, with the psychologist, so where they would do more counseling or invasive interaction with the person. And then if the psychologist realize that, okay, this person definitely needs more assistance where you'll have to have medication, then they would be recommended to see a psychiatrist either in the psychiatric clinics where they are situated all over Trinidad, or they can actually go to the hospital settings where you have a clinic in Mount Hope Hospital as well as St. Anne. I just want to add with the medication that yes, taking your medication is good and stuff, but the problem that really exists in patients that I have seen on set is when their prescription finishes and they reach that optimum that they good, that all right, it worked for me, and then sometimes some go into withdrawal symptoms because they choose not to go back. So the doctor might say, okay, yeah, come back in 6 weeks. And in 6 weeks' time, some do get a big turnaround within the 6 week time. So the help of the medication as well as the help of the counseling, because these two things for mental health, it goes hand in hand. And yes, medical medications as well, sometimes the pharmacist does counseling with them because apart from the side effects, apart from different experiences that your body may undergo when you introduce these medication into your body, especially first time users, you know they tend to be like, some of them, they'll be like, okay, yeah, I'm better, and they just disappear from the clinic. Some of them, they say, well, all right, I good, and choose not to return, and then they have a period where they dip. It doesn't happen to all, and when they do that, they tend to be that is where some of them you would find, like where you've heard where people would have commented and said, well, this person got addicted to the medication because it's like they change within the 6 weeks. Their family members would have seen an improvement, they would have seen that they're okay, and then it would have been reverted to something, oh my gosh, it come like a back to square one or even worse. So taking the medication is one thing, yes, which is very agreeable, but your follow-up is of importance. You don't just walk away. The doctor don't just tell you 6 weeks and that's it. You need to follow up in a clinic. You need to be told that, okay, your prescription has ended, you're good to go. Let's try 6 weeks without your meds, see how it operates. You don't take it upon yourself to come up, because some people, they even do that. I'm sure we are all guilty of a typical, you go by the doctor for a simple thing as a common cold. And they tell you, well, here, what, take these two Panadols 3 times daily for the next couple of weeks, let's say 2 weeks or whatever. And on the third day, you're fine, you're good, you're normal, you truly packed there, and you say, I good man. Well, you telling me about 2 weeks I take Panadol down, just especially cough syrup, and I know coughing again, and we take these things for granted. We take these things for granted. So it's not just taking your meds, but follow up is of very important. So that's just what I wanted to add. I hope you all, like it.
So before, when you said to start with the social workers, I remember that I actually did start by going to CAPS, that's UE's counseling service. That's where I started, and I got a referral. They told me that I should see a psychiatrist to get a diagnosis and some medication. In my case, I've been on medication for a year. My proposed time to end is after I graduate UE, because the psychiatrist said that UE may be, that not just UE itself, all of the obligations could be a reason that I'm under all of the stress. So I have chronic depression, which means basically my whole life. So I don't know how long I'll be on the medication. But I have to go back to see a psychiatrist every 5 months. That's how it works. You go back every 5 months, or you have no more medication. If you have no more medication, you go through withdrawals, which is very difficult. I actually been going through that recently. Right now, luckily, I got my meds. But withdrawals, just stopping these psychiatric medication, it's very difficult and not at all suggested. Because if, for example, you are on antidepressants, especially SNRIs and SSRIs, there are actually permanent effects that can remain if you just stop your medication just like that. You can have a permanent serotonin syndrome. I can't remember the exact name for it, but there is a syndrome you can get that will last permanently if you just stop. It's unlikely, but it can happen. Yeah.
And that's the thing I just want to add to Ananda's contribution. Is like, even though you are going through your withdrawal symptoms, you're not going through it alone. I mean, and this doesn't mean with the assistance of your family. This means with your follow-up clinics, because you didn't willfully stop on your own, like how some people would start and they would have the perception that, okay, I'm feeling better, I'm back at this pinnacle place in my life that, I'm good, I'm happy, I'm back at the happy place, or what have you. And you don't just stop just like that. So that is what and my point driving, that what you were saying there, that you do go through this, but the doctor is very aware, because remember, they need to see as well, they need to evaluate your doses. They need to evaluate, okay, so how long does it take her to actually go back to the place when the medication is not there, when you don't have this, or you don't have the counseling. Let's debrief and see exactly what's happening. So that's it. But there are people, they don't bother, they don't return. They only return when they realize that, hey, I'm back to square one, or even worse than before I started. And this is why we our citizens are like this, where you would find a lot of the mentally ill people just there, and it appears that there's no help for them. But sometimes we I mean, it's harsh to say that we are to blame, because we don't half of us don't really follow, especially like as I say with the cold, right? How much of us probably even went to the dentist, say extract a tooth and is it there? If we have to do any move on. You ain't going back to the next screening or who knows, her next toothache. And that's what we do. That's what we do. We just, we just go ahead with this prescription. Okay, fine, we feel better, we move on. Because there's a lot of things that a lot of people do like to go follow up. One, the financial costs. Come like you have to pay 2 visits to the doctor. I feeling good. Why go by the doctor for? Why mentally fine? Why go and by her for her or him to sit down and tell me XYZ, blah, blah, blah. So these are things that, yes, the medication is of importance. Yes, we driving that factor through, but we also have to like drive the factor towards and you're following up medications, you're making sure you're changing your prescription. When your prescription change, hey, here what's going on, doc, I found something different. I find I was sleeping too much. This is a higher dose you give me. All these kind of things of importance. And these are everyday things that we all, you know, have experienced in our lives. So when we do reach into that position, because I mean, one psychology is your main thing in this whole region here. When you go and you actually sitting down, you counseling somebody who is being medicated by the psychiatrist, and not just the psychiatrist have you there as well. You could mention your experience. So when somebody telling you, hey, I going through this withdrawal symptom, and it's like, whoa, you actually experience it. And that's what makes, the professionalism better when you actually could tell somebody, yeah, I hear you, I feel you, I know exactly what you're going through, but at the same time, you need to do this because I can't stand here and counsel you, or I can't assist the psychiatrist without I doing this. So look at me today, and life experiences helps. It really does help, especially everyone here opening up and talking about it. And it does. I mean, some people that is just listen, but you actually you hit home. So it is commendable that we all are on this, and we could base our life stories on this as well. Yeah.
Another issue that I realized a lot of people have is that they assume that these psychiatric medications are like those one size fits all. They aren't. It's different for everyone. Not the same medication does not work for everyone. For example, the medication I'm on right now is Prestige, and it works really well for me. I have little to no side effects. But my friend, when he was taking the same tablet, the same medication, he had a lot of side effects. It's He's been through probably 6 different antidepressants already, and still trying to find one that works for him. In my case, I ended up getting one that works for me from the beginning, which was honestly really lucky because it's actually very difficult to find the one that works for you on the first try. So if you get a psychiatric medication that doesn't work for you, try another one. Well, obviously, you would go back to your doctor, tell them what's going on, and they would suggest another medication. Don't just stop taking it, especially during the first 2 weeks, because the first 2 to 6 weeks are actually where your body adjusts to having the medication. For certain medications, that's the ones that you take daily. Those your body needs time to adjust. If you don't let your body adjust, you're just going to have um, there'll be no positive effects. In the beginning, there's a lot of side effects. When I started taking my antidepressants, for the first 2 weeks, I pretty much slept all day, every day. I had a lot of confusion, a lot of anxiety. I had a lot of side effects. But then after those 2 weeks, it was honestly surprising how my mental health turned out. I got so much better, and it was amazing, honestly. So don't just assume that just because this one medication isn't working for you, that you're not going to find one that does work. you have to keep trying sometimes.
I'm so grateful that we have our members from the executive team who are well versed in this topic and are able to share their experiences. Thank you so much. And I hope by listening to them, you will feel more comfortable to open up to ask questions or maybe in turn to go and check out the clinics by yourself to actually get help if you really do need it. At this point, if you have any questions, you can feel free to ask. But while I wait for you to unmute and ask, or you can type it in the chat if the chat is still available. I just want you all to know that you should not feel ashamed to ask for help. And I know, at least in the Caribbean culture, whereby you still need to ask your parents or run to your parents first before you do anything health-wise, doctor-wise. I know the discussion is difficult. Some parents can't adjust to the fact that their child needs help in terms of feeling better. They think that like Sadiqa mentioned previously in the beginning, it's spiritual. Some of them think, no, you just don't know how to cope or deal with things, and that's part of becoming an adult. But what they don't realize is they are using what they were told as children to compensate for how they felt or how they were dealing with their disorders or their struggles, and they expect you to do so in turn. But we are living in a progressive age whereby you should not feel inclined to hide or to listen to one perspective and be like, okay, I should do as they say, and if I don't get better, the problem lies with me. It should not be like that. Psychiatric medication is there to help you all through a process. So if you know you have a chemical imbalance in your brain for depression, or for any disorder, the medication is there to help you. And if they want to say, no, it's not going to help you, you can always say, just because you don't see it doesn't mean it's not there. You would do the same thing for, let's say, you have an internal wound, you would take medication for that. So try to talk to your parents, try to talk to your relatives, your family, your friends, to encourage them to see psychiatric medication in a new light. And this narrative people will purport in the Caribbean where they say you become dependent on it or you're not a strong person. And Sadiq said it before, it's completely false. People just don't know how to handle mental health discussions properly in a healthy manner, in an appropriate manner. People pass it off as jokes. There's insensitivity about mental health and about the medications or the people that need the assistance. And I believe for us as psychology students, we need to break the stigma. We need to start from that narrative and show them how it is wrong and why it does more harm than they expect it to. And to be quite honest, this panel session was inspired because our Vice President for SPA, Salma, she realized that a lot of psychology students, they actually hold a lot of stigma towards psychiatric medications. There were jokes going on about using bush tea and going to the pundit. So I get that people would like to use a different belief system or have different hopes on how to cope as human beings. But if you do it in a way as, and especially in this field of study or this profession, whereby you might stop somebody from seeking out help, that is not the wisest decision. And in fact, you're counteracting all the progress you've made in your field of study towards helping people or actually giving proper, credible advice. So this is why we need to, continue the narrative, continue the discussion. Why psychiatric medication is important, and as Crystal mentioned, we need to pair it off with the counseling. So don't just say that you want to be a psychologist, you want to counsel, but you denounce medication. You can't do that. It works for people. Some people, it may not work for them, they may stop it. And that's fine. It's different for everybody. There are different types of therapy. And this therapy we're talking about today is just for drug medication or drug therapy.